Welcome to Unscripted, the AMCP podcast, a look inside managed care pharmacy. Listen in as experts explore the challenges, innovations, and opportunities shaping healthcare for millions of patients. Welcome to this episode of Unscripted, the AMCP podcast. I'm your host, Fred Goldstein. We continue our rare disease series discussing managed care considerations for incorporating patient value. Today we'll be focusing on the rare disease IgA nephropathy, one of the leading causes of kidney failure. This is supported by an independent medical education grant from Alexion and AstraZeneca Rare Disease. Make sure to check the show notes for additional information. It is now my pleasure to introduce our faculty for today's program, Ami Gopalan, Senior Vice President of Strategic Content and Growth Optimization at Precision AQ. Welcome, Ami.
Thank you for having me. And I just want to say I'm here serving as faculty, but I also have the hat here of being a patient. I was diagnosed with IgA nephropathy 5 years ago.
Thank you for providing that information. Obviously, critical information to have to be able to discuss this from both sides of this. So why don't you go ahead and tell us a little bit about IgA nephropathy?
Yeah, IgA nephropathy is a rare progressive autoimmune kidney disease. It's rare as it affects about 200,000 patients in the United States, but that diagnosis rate actually does vary sort of across populations across the world. In China and Japan, biopsy rates, which is typically how IgA nephropathy is diagnosed, up to 40% of biopsies show that patients have IgA nephropathy compared to 10% in the United States. So that's why it's rare. It's a progressive autoimmune disease, as what we know about this is that the damage that's being done to the kidneys continues, and it's due to the deposition of galactose-deficient IgA molecules or complexes in the kidneys. And that deposition sets off a cascade of inflammatory events, which causes the kidney damage that we see in these patients.
Is it typically because of needing that biopsy picked up late?
It is. Most patients do not get diagnosed until they're typically in stage 3 CKD because they have no symptoms. So they're walking around, things are okay, or they think things are okay, but all the while that kidney damage is occurring. And it's not until they have some of your late stage symptoms that they're typically presenting to care.
And you mentioned stage 3. What is the clinical progression of the illness?
It is, so I noted it's a progressive autoimmune kidney disease. What typically ends up is you end up needing dialysis or transplant because of the progressive nature of the disease.
And obviously something like that is very expensive.
Yeah, it is extremely expensive. And I think it's also important to sort of keep in mind for those that transition or get a transplant and who are fortunate enough to find a match and go through that entire process. Because of its progressive nature, you're being diagnosed probably in your 30s or 40s. About half of patients may end up in end-stage renal disease within in their 50s, while Medicare may cover their dialysis and that transplant. They may need another one, right? So IgA nephropathy doesn't go away. And so I think that's just another thing to keep in mind is that this is something that you'll see both under your commercial plan as well as your Medicare plan. And, the end all be all in this case is not a transplant because it's very common for it to show up again.
So I would imagine, given obviously the intense clinical issues associated with it, the disease burden on an individual and their family must be pretty severe.
It definitely is. It's one of those, obviously, any disease is going to change how a patient and their family needs to really live their life. And this is no different. Interesting, because it's not something that people see. There's an intense, invisible burden and a mental burden just in terms of dietary changes that may need to be made, what that does in terms of, relationships between family and friends. There is a lot that patients have to deal with.
And where are we in terms of treatment for this illness?
I would say it's exciting, but it can also be causing some concern. IgA nephropathy, I noted as it's, this immune-mediated disease, we know a little bit more about how that progression occurs. And so a key component of this is the deposition of galactose-deficient IgA1 molecules in the kidneys, in the glomerulus specifically, which sets off a cascade of events. And so now we have a couple treatments, or a few treatments really, that are on the market, and we have several more in pipeline. And with those in pipeline, I think that's where we're seeing some really good information and data as it relates to management of the disease. But at the same time, there's a lot of new drugs that are coming out as well.
And you mentioned the impact, obviously, it's on patients themselves, and then the issues around the broader issues of mental health, et cetera. So where are we in terms of looking at patient-reported outcomes and bringing that information in?
There's some work that's being done by the IgA Nephropathy Foundation to collect some of this information and really demonstrate some of the emotional burden that's there. The manufacturers that have treatments available here have been very supportive of the foundation and are sort of supporting some of those efforts to really engage patients.
And what are the advocacy groups that are working on this finding, and what are they seeing with this area?
Patients are challenged because as a rare disease, they probably haven't met anyone that has this condition. So trying to find like-minded groups of people to sort of find people that understand what they're going through, that emotional toll as it relates to having a lifelong chronic condition, knowing that there is no cure, has definitely posed challenges for patients. And another thing I think to point out is that this isn't just a disease of adults. I noted that most patients may get diagnosed in their 30s or 40s, but there's a significant pediatric population, and so that can turn entire worlds upside down. And so IgAN Foundation in particular has been really supportive of patients, families, and caregivers.
Given both your background as a clinician as well as a patient, how should managed care be looking at this?
Thank you for letting me answer that question from both the patient and the managed care perspective. Let's start with the managed care impact. IgA nephropathy being a rare disease, the treatment options that are available are typically being approved through the accelerated approval pathway. And that means surrogate endpoints. And in some rare diseases, the correlation between a surrogate endpoint and that actual effective endpoint the data might not be that great. In this case, the data is pretty strong to show that the reduction in urine protein levels does correlate with the reduction in eGFR decline. So I think that's just an important thing to sort of keep in mind for this rare disease versus others. That being said, obviously we do want to see what that difference looks like over, for eGFR decline, once full data is available. Coverage criteria is another thing. And coverage criteria in this space is likely going to be aligned to the clinical guidelines. The clinical guidelines were recently updated in October of 2025, and they note a management goal of less than 0.5 grams per day of protein in the urine. They also note, ideally, that protein should be managed to less than 0.3 grams per day. And so, as managed care entities, we need to be thinking about, so what are we going to use as our cutoff and sort of management of ensuring who has access to these really promising new therapies? And so I'm going to flip that over then to the patient side. As a patient, I really hope that, we're looking for that lower endpoint, right? 0.3 grams per day, which really demonstrates that a patient is in remission, because that really offers patients the opportunity, or the greatest opportunity, honestly, to maintain their own kidneys. And, for that's, I think, just something that I'd want to make sure folks kept in mind.
Well, that's really excellent. I'd like to thank you, Ami, for coming on.
Of course. Thank you.
And thank you for listening to this episode of Unscripted, the AMCP podcast. Join us for the next part of this series as we dive further into rare diseases.